Anxiety disorders can mostly be treated on an outpatient basis. There's very, very rare that we have to treat it as an inpatient or patients have to be admitted for that. It doesn't happen unless there's a lot of, maybe they have suicidal ideation or the symptoms are so severe that, or they've not responded to medication. So in those cases we may consider, but for the most they are treated at home with a combination of non-pharmacological and pharmacological interventions. So if you look at what are the various non-pharmacological, which also comes under lifestyle modification kind of treatments, we would be looking at firstly sleep, which we've talked a bit about. Very important to get that sorted. Very important to explain and allay the anxieties associated with sleep. That it's okay, and something around we may not need as much sleep as we get older. A body can do with fewer hours of sleep, and it's all right. It's not going to trigger off another illness. So reassurance around that. Secondly, things like nutrition, because a lot of elderly people probably feel that I'm alone, there's no need to cook a fresh meal every day. So they somehow tend to, which we all do, if there's not a big family to cook for, then you would end up trying to make do with whatever is there, or the shortcuts, take shortcuts. But that can cause nutritional deficiencies, which also can trigger off other conditions and anxieties. So it's important to address the diet of the person. Things like activity levels, to see what is their normal day like, how much physical activity do they do, how much of social activities do they engage in. All this is very important under what I call the lifestyle modifications or non-pharmacological interventions. So look into it, see if there's anything that can be suggested which is practically applicable. Also involve family members, so build up the support system around the person. That would certainly help. When we look at the medication for anxiety disorders, there are medications, but we would try and reserve them to see, once we have tried out the lifestyle modifications, and if they haven't made a difference, or it's not possible for the person to initiate the changes because the anxiety is so high, then we might introduce medication at the beginning. And this, the mainstay is of course a group of drugs which we call the SSRIs, which are antidepressants but are used in anxiety. And then we go up. If they don't respond to the SSRIs, then we move on to the SNRIs. Okay, so when we talked about the antidepressant group of medications that can be prescribed for patients with anxiety disorder, but the important thing when we're prescribing for any elderly person, be it an anxiety disorder or a depressive disorder, is to start with a low dose. Start low, go really slow, because it takes time for the medication to build up in the system. So the frequent dose increases that we would see in an adult population ideally should not be done in an elderly population. So we wait a while, at least 4 to 5 days before increasing the dose, sometimes even longer, even up to 1 to 2 weeks before increasing the dose. And it may require a much prolonged duration of treatment as opposed to a younger population, because it takes longer to treat. So reassuring the person that there will not be any other harm, it will not interact with other medications that they are on. It is required because it is as important as the medicines that they take for diabetes or hypertension to keep their quality of life, to ensure that they are functional. At the end of the day, what is the point of being alive if you're not able to do things and go around and do things that you enjoy and are functional and independent? So treating the anxiety will help them stay independent and functional, which is as important as treating their other physical health conditions. So those would be the general instructions to people who are taking medications for anxiety disorders. It's important to remember that. There's another group of drugs which we call benzodiazepines, which include drugs like Restil and Ativan, which are also very commonly prescribed in an elderly population. They certainly would relieve people of anxiety, but they have a huge addictive potential attached to them, and which is why we are very wary of prescribing benzodiazepines. If possible, completely avoid them. And if there are people who have been taking drugs like Restil, which I see quite commonly, that some of my patients have been on these drugs for 30 years, 40 years, they've been getting it over the counter, and now there is symptoms of anxiety which are more pronounced, then it's not that I take away the Restil completely, and that would be a big mistake, because the person has got so used to this. Whether it's doing anything or not, there's a huge placebo effect attached to the medication. So this might not be the right time to address the Restil and take it off. But we need to work along with them, we need to talk to them about it, prescribe what is required to manage the anxiety, both the lifestyle modifications and the antidepressant group of medications, and eventually, once the person is ready to work with us, start looking at reducing the benzodiazepine as well. A lot of anxieties are related to these unrealistic worries that the person has, irrational fears that they have. And it is important that we discuss these things with them, ask them to elaborate upon these, challenge some of the beliefs that they have around these situations, and slowly see how we can get them to think in a more positive manner. So the mainstay of treatment, the maintenance in terms of anxiety disorders, is talk therapies or CBT, because that is what is going to hold good in the long term. That is what is going to create the whole change in their way of thinking, and which will be what helps them, or which prevents another anxiety disorder or another anxiety attack from coming and, distressing them in the future. So yes, it is primarily what we try and do to help somebody with an anxiety disorder. And if talk therapies fail, they don't give us the results, or the person is too severely anxious to engage in talk therapies, is when we would try and look at prescribing medications to help them.